Madam President, as the ranking Democrat on the Senate Finance Committee, I followed our colleagues' comments with respect to taxes and the debate over tax reform with considerable interest. And I will just tell you, my goodness, how I wish we could have what our colleague called an uninhibited process with respect to the debate over tax reform. I've written an actual bipartisan tax reform bill with our colleague who's now a part of the Trump administration, Senator Coates. Unfortunately, what our colleague laudably called for is not on offer. The Senate Majority Leader has said that he intends to use reconciliation, the most partisan process for considering tax reform. So, when we were talking about health care, that's a sixth of the economy. We had the same process, reconciliation, all partisan. Now we're talking about taxes that involves the whole economy, and we're seeing the Senate Majority Leader say that once again it is his intent, his preference, his plan to use that same process. So I sure wish that the world was like my colleague has called for, because I've written a bipartisan plan. And what's so striking is what the Senate Majority Leader has called for is 20 hours of discussion, which is essentially what you get with reconciliation, as opposed to what happened when Ronald Reagan and a big group of Democrats got together in 1986 and spent a whole month on tax reform. So before my colleague leaves, and it is a pleasure to serve with him on the Senate Select Committee on Intelligence as well, I sure wish the world was along the lines of what my colleague has called for, and perhaps he can use his intellect and energy to persuade the Senate Majority Leader to use that process on taxes, because that's what Senate Democrats have called for. And I can just tell my friend, given my interest in the subject, which goes back well over a decade, we've got a bipartisan proposal written, co-authored by a member of the President's cabinet. So we'd very much like to have what my friend and colleague is talking about. Madam President, I rise now to oppose the nomination of Eric Hagen to be Deputy Secretary of the Department of Health and Human Services. This is the #2 position at HHS, the Chief Operating Officer. And of course, with Secretary Price's departure, Mr. Hagen would fill into the top spot if he's confirmed. And I come to express my concern is that I just don't have any confidence that Mr. Hagen is going to lead the department in a different direction than it took under Dr. Price. Last week, the country watched as more and more details emerged about Secretary Price's travel. The flights, in my view, were an abuse of office. But in my view, there was, from the very outset, a reason to be concerned about Secretary Price and how he handled the public trust. Ever since our committee received the Price nomination, it was clear that he had little trouble flouting the rules when it served his own personal interest rather than taxpayers. He used insider information from a fellow congressman to get a sweetheart stock deal that made him hundreds of thousands of dollars. He frequently bought stocks in industries he was overseeing as a member of Congress, and he pushed health care legislation that benefited industry insiders rather than patients. So he was confirmed on a party line, vote, and it wasn't very shortly after that where he really proceeded to go forward with what I and others consider a sabotage campaign that, in effect, has been being executed since day one. He was a top salesman for Trump Care. He came before our committee and made countless other public appearances at which he willfully misrepresented the massive scale of the harm Trump Care would have done to American health care. He also appeared on national television and argued, in effect, that health care funding cuts aren't actually cuts. He denied that individuals would lose health coverage or see costs increase as a result of Trump Care, even after there were independent analysis showing that that was wrong. And then, of course, he flew about the country scaring folks who just wanted affordable health care. And as far as the president's promise to bring down the high prices of prescription medicine, and Madam President, that was a promise that the American people got at stop after stop after stop on the campaign trail in 2016. That promise is nowhere to be seen or heard from at this point. Now, it's my hope that the president's next pick to lead Health and Human Services is going to follow through on what the American people were told they were going to get in the campaign, which was to lower the costs of health care and get our citizens covered. But that nominee hadn't been put forward. In the meantime, Mr. Hagen's nomination has him in line to serve as acting secretary. I will tell you, having examined the record as closely as I could, I don't think there's any reason to believe Mr. Hagen would deviate from Secretary Price's ideological agenda that included a constant effort to undermine and, in my view, sabotage the implementation of the Affordable Care Act. This campaign, in my view, is driving up premiums and confusing Americans who just want to be able to see a doctor and get affordable health care services. So I'm going to tick through some of the actions the administration has taken that would undermine the upcoming open enrollment period and the effect that's going to have on our people's health care costs. First, just a few weeks into his tenure, Secretary Price cut the enrollment period. So this is the period when Americans sign up for health insurance. And we're talking about a private marketplace. Madam President, I'm really struck by this debate about the role of government. We're talking about a private marketplace where private health care plans offer coverage, and the Secretary Price cut the enrollment period for private health care at the private marketplace in half. People across the country used to be able to sign up for health care from the beginning of November to the end of January. Now they have literally half the time. That is going to cause a whole lot of disruption for people who are just working hard and living their lives rather than trying to follow every little press account from Washington, D.C. So let's just imagine for a moment a 29-year-old who just got locked out of the healthcare system because he's had a 3-year routine of signing up for health insurance around the new year. That's exactly the kind of individual that the private insurance market needs to attract in order to hold costs down. A young person who's probably signing up right towards the deadline. And then think of the single mom with 2 kids who marked January 30th, probably with a big bright pen on her calendar because she cut it close at the end of enrollment last year. Her life is busy enough. She doesn't read trade publications from health industry sources to see what's happening with open enrollment. Because of the early enrollment cutoff, now her family, this mom who just wants affordable private health care from the private marketplace, is going to be locked out. The Health and Human Services Department is taking the healthcare.gov website offline for maintenance on all but one Sunday during the open enrollment period. And the fact is, Sunday has been one of the most popular times for well-meaning assistance groups to help folks get signed up at community centers. It's like a state Department of Transportation blocking the highways and digging up the blacktop with construction crews every Monday morning during the peak commute time. It's just the opposite of common sense, Mr. President. The department is kneecapping the programs that are designed to get highly trained people These are folks called navigators, and what they do is get out into the communities and go to various places where they know a lot of folks aren't signed up, and they help them get signed up. The Department of Health and Human Services has slashed the budget for getting the word out, including zeroing out the budget for TV ads, and that was a big factor in getting enrollment up in the past. So let's be clear about what the department has done under Secretary Price's leadership. They've been working overtime to make it harder for people to get health care, plain and simple. But the sabotage doesn't really end with just making enrollment a headache. The administration continues to dangle the threat of cutting off cost-sharing payments as if it was a political game without consequences in the real world. In state after state after state, insurers have made it clear that this gamesmanship is causing premiums to go up. If the payments are cut off, families will face premium increases of hundreds of dollars or more. And it's all because they're searching for a political trophy. So again, Mr. President, I want to talk about what this means for private sector health care. When you have the President and the previous Secretary of Health and Human Services pouring gasoline on the fires of uncertainty in the private health insurance marketplace, it makes it very hard for insurers to make the calculations that are involved in spreading risk and getting people signed up and pricing, products. And the reality is an administration that says they really care about the private sector, and the President continually says that he's from the business community, he wants to be sensitive to private sector economic forces. The last thing you would do is pour all this uncertainty into the private health care landscape, which is what they have been doing with the gamesmanship in terms of whether or not they were going to pay these cost-sharing payments so that, folks who face big deductibles and extra prices for medicine and the like, that they knew that there was going to be some help in their health plan for those costs. So the Secretary was out jetting all about, spreading falsehoods about the private health care landscape, and sometimes he would say it would be collapsing, and I'd say, well, we know a lot of people who are trying to stabilize it, but you're making it harder by, as I say, pouring all this gas on the fires of uncertainty. While this was going on, they were also neglecting to work with states. For example, Oklahoma designed a reinsurance system intended to stabilize the private insurance market and control costs, and they sought a waiver application to the Department of Health and Human Services. But the Department of Health and Human Services didn't get around to improving it in time to help Oklahomans in 2018. So the state just pulled their applications. And I have been a strong supporter of these waivers. I authored the provision in the Affordable Care Act, the Innovation Waiver, 1332. And for the Secretary to not work with Oklahoma in a timely way, in a way that would stabilize the private insurance market, is not what those of us on this side are in favor of. There's no reason to believe Mr. Hagen will come in and clean up the mess. Many states, in my view, want to see stable or reduced premiums this coming year, but so far the department is just marching in lockstep with the status quo. And the President, who apparently is just committed to continuing this kind of mismanagement and willful wrongdoing. Mr. Hagen has made it clear what his stance is on the Affordable Care Act in plenty of public statements. So beyond this question of undermining the Affordable Care Act, we were also particularly troubled that the Secretary, Tom Price, shared the Trump administration's abysmal record of responding to oversight letters from Congress. especially Democrats, but as far as I can tell, some of this is shared on both sides. I think this is profoundly undemocratic, and our obligation to perform oversight as members of Congress is derived from the powers laid out in the Constitution, in Article 1. And the issues we raise in oversight inquiries to the Department of Health and Human Services relate directly to the well-being of people in North Carolina and Oregon and everywhere in between. And I don't think senators on either side, Democrats or Republicans, do it for sport. But the administration's behavior is not that of a government that sees itself as answerable to the public. Either that, or it just doesn't have good answers to why it just constantly is out there undermining private health insurance markets and making it harder for people to get affordable health care. Either way, they aren't doing their jobs and they aren't putting the interests of the American people first. So members on both sides of the aisle have expressed concern about this department, the Health and Human Services Department, stonewalling important oversight issues presented by members on both sides. Chairman Hatch and Senator Grassley, two very senior Republicans. Chairman Grassley, Chairman Hatch, they deserve a lot of credit for calling out the Trump administration on this lack of responsiveness to basic oversight. But the fact is, what our committee has heard is basically a lot of sweet talk from nominees about how, of course, they're going to be responsive, and then they go out and it's business as usual, and we see them for that confirmation hearing and not much of any kind of response when we ask questions. So I will not support Mr. Hagen's nomination today. Under Tom Price and this administration, the Department of Health and Human Services has done, in my view, a miserable job of working to improve the health and well-being of the American people. And the irony is, it seems that one of the objectives from day one was to set out and try to accomplish that, to make it appear that there were problems when the Affordable Care Act was being implemented, and instead of rolling up your sleeves and tackling it, the idea was to try and get an ideological trophy. Let's tell the American people that everything is horrible about the Affordable Care Act so we can get it repealed. And Mr. President, as I've said, the Affordable Care Act is far from perfect. And in fact, when we were debating it, I had an alternative plan. We had 7 senators on both sides of the aisle. So it's a bipartisan plan. But that's history. The Affordable Care Act has made an enormous difference for millions of Americans. And what we ought to be doing is working together to improve it. And there are plenty of ways in which this Senate and an administration that really wants to accomplish that can work together in a bipartisan way. What I have been more interested in than any other aspect of public service was to work in a bipartisan way on health care. That's been my #1 interest. So nothing would please me more than to be able to say, okay, we've got an official who's going to break with the past, and instead of trying to make the implementation of the act as bad as possible, was prepared to roll up his or her sleeves and make it as good as possible. Unfortunately, that person is not Mr. Hagen. I urge a no vote, and I yield the floor, and I would note the absence of a quorum.
Clerk will call the